Under eye wrinkles? I have those really ugly, deep wrinkles under and around my eyes. I was wondering what could be done to permanently get rid of them. I've tried Juvederm before, but it left me with horrible bags under my eyes, so fillers are not an option for me. I'm also trying to avoid surgery, so I was wondering about any lasers or chemical peels that would do the trick. Thank you in advance for your advice.
Thank you for your question. You submitted a photo which appears with you smiling or expressing the lines and wrinkles that you don't like. And you've described a history where you've tried Juvederm and it created bags, and that you want a permanent solution and you want to avoid surgery. So, as a cosmetic oculofacial plastic surgeon who's been in practice for about 20 years, I can tell you that this is a question that arises pretty much every day. And the reason that we have to understand why people have these wrinkles and these other concerns, and that certainly the desire always is to avoid surgery. So let's break it down to why you have the wrinkles and what are the key elements that define the under eye appearance. So number one, let's start with the wrinkles that you're bothered by. You made an expression and it created these wrinkles. Well, expression resulting in wrinkles is referred to as dynamic wrinkles. And the dynamic wrinkles are based on the activity of a muscle. This, around the eyes, that muscle is called the orbicularis oculi muscle. When that muscle contracts, it causes these wrinkles to form, the crow's feet lines, the lines under the eyes. So when we manage dynamic wrinkles, we do this with a medication called Botox or Dysport. Now these are medications that actually relax the muscle in a selective way so that when these muscles are activated, the wrinkles are not as deep. We can't eliminate wrinkles altogether, but we can reduce the activity of those muscles. Plus, another factor is the actual physical movement of the cheek. So if you passively move your cheek upward, you'll see that those wrinkles will form. So it's all about improvement, and certainly that is, of course, non-surgical, but it does require maintenance. So the question about permanence is basically, it's just not practical. In our practice, people come for treatment of dynamic wrinkles anywhere from 2 to 4 times a year, depending on their situation and their desire. The next kind of wrinkle to be aware of is called static wrinkles. Now, static wrinkles are the wrinkles under your eyes that are always there. Not only are they similar to dynamic wrinkles in that when you stop smiling and you're at rest and those wrinkles are still there, they're also the crisscross wrinkles that are seen typically related to aging and sun exposure. So for static wrinkles, we try to do everything to build up the skin quality. And if you think about it this way, if you crease paper over and over, the backbone structure of the paper breaks down to the point where a crease will be permanent. And even if you use an iron, you can't completely iron it out. So what our goal is to improve those wrinkles. So we use technologies depending on the skin type, such as fractional CO2 laser, microneedling, as well as the use of platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and what we do is we concentrate the active healing factors that come from platelets, the cells that are responsible for clotting your blood when you get a little cut. So we try to do it in a combination approach of activating your regenerative capabilities by using platelet-rich plasma, as well as getting the beneficial effects of thermal energy and literally taking off a top layer of skin and getting new fresh skin. So that's the solution for static wrinkles. Last but not least, and I think is why you had the unfortunate experience with the Juvederm, was that when I look at your photo, the under eye area appears to be having a little bit of puffiness. Now, that most likely is something called lower eyelid fat prolapse. And lower eyelid fat prolapse is the puffiness under your eyes that is always there regardless of the amount of sleep you get or whether or not you've managed your allergies and sinuses. And it's typically a genetic trait that will manifest at different stages of one's life and is sometimes associated with just age-related changes. So when you think about your under eye area, you may want to take a step back and look at yourself with your face relaxed, with your face smiling, and try to kind of prioritize what are the things that bother you the most. Because I think that even when you treat your wrinkles, if your under eye puffiness is still present, it's not going to make you look as good as you possibly can. So with that understanding, I think you need to now do some consultations with experienced, qualified cosmetic specialists. I would recommend cosmetic surgeons basically because they have the option of doing both surgical and non-surgical procedures, and learn about your options and understand that permanent non-surgical is really not practical. Our bodies continuously change, and the impact of genetics, environment, stress, all of these are factors in what affects the appearance of the under eye area. So I wish you the best of luck. I hope that was helpful, and thank you for your question.